and welcome to our today's special panel discussion, Women versus Cancer, the power of genetics, nutrition and the mind in healing. On behalf of 4-Base Care, it's a pleasure to us to have you all join us today. As we celebrate International Women's Day, we will focus on an issue that affects many of women, that is the fight against cancer. According to the latest Globocan data, the female breast cancer has surpassed lung cancer as the most commonly diagnosed cancer, with an estimation of 2.3 million new cases in the year of 2020, which represented 11.7% of all cancer cases. Today, we have come together with the goal of discussing how we can provide care that will focus on every person's unique need and not just the illness. We are joined today by an incredible group of experts, a genetic counselor, an onco-psychologist and an onco-dietitian, each of whom will share valuable insight regarding female cancer care and how we can provide care in a more personalized and compassionate way. And I, Ms. Aditi Mukherjee, Manager of Patient Care and Engagement Team, will be moderating today's event. But before we begin, let me remind you all that this event is for you, the patient and the caregiver. Your experience, your thoughts and your queries are at the heart of today's conversation. So please feel free to share them throughout the session. Now, let's get started. To kick things off quickly, let me introduce you to our panelists. Today we have with us Ms. Vaishnavi S., a genetic counselor, Ms. Jaitri Mandal, our onco-psychologist, and Ms. Sharmela Devi, our onco-dietitian. As we know, cancer is gene-driven. So, let's go to our genetic counselor first. Welcome, Vaishnavi.
Thank you, Aditi.
Vaishnavi, can you brief us about some cancers that affects women and what genetics play part in it? What role genetics play part in it?
Yeah. So before we see what cancers affect women, let's just see first what a cancer is and what part genetics plays in cancer. So this is a lesser known fact or something that is not given a lot of importance, but then all of cancers are genetic disorders. Basically, if errors in the DNA or then changes in the DNA is what causes cancer. Now these cancers, they can either be hereditary or non-hereditary. So when I mean hereditary, it basically means that this cancer is something that has been passed down from generation and generation in the family. So basically this is inherited at the time of birth and this will also be passed down in the future generations. This is a DNA error that is passed down in the family. Now, when it is a non-hereditary cancer, this basically means that this is not inherited in the family or not inherited from generation to generation. This is a DNA change or a DNA error that has led to a cancer through the course of one's life, and this will not be passed on to the future generations. Now, non-hereditary cancers can be occurred because of a lot of factors like lifestyle factors, environmental factors, pollutions, chemicals, radiations, etc. But then hereditary cancers, as we see, only 5 to 10% of all the cancers are hereditary in nature. Now, women worldwide are affected by a lot of hereditary and non-hereditary cancers, mainly gynecological cancers. Now, to see the most common cancers in women, the first and foremost that we see on a daily basis or in a very common basis is the breast cancer. So, 1 in 8 women are affected by breast cancers worldwide. Next, the second most common cancers that we see are the cervical cancers. Then the fifth most leading cancer deaths that we see are the ovarian cancers. And the most common gynecological cancers that are seen are endometrial cancers. Now the most important thing here women have to know is that they should be aware of their bodies and they should be aware of any signs and symptoms that could mean abnormality. So by just like how after a certain age people go for regular health checkups, regular diabetes or blood sugar, blood pressure checkups, Just like that, regular cancer screenings, regular breast cancer screening like the breast MRI, or then the CA-125 testing for ovarian cancers, that can help them monitor their risk of cancers. Or sometimes even by doing the prophylactic measures like taking a vaccine for the HPV, which is the human papilloma virus, which causes the cervical cancer. This can completely get them rid of their risk in the future of cancers.
Thanks, Vaishnavi. I'm sure these informations will be immensely helpful for our patients as well as for our caregivers. Now, I would like to know from you what are the symptoms of hereditary cancer and how women can prevent it.
Yeah. So a number of hereditary cancer syndromes are seen in women. To name a few, the most common ones, the HBOC, which is the hereditary breast and ovarian cancer syndrome. Next is the Lynch syndrome, which commonly causes uterine cancers or endometrial cancers, and then even the colorectal cancers. And then the Lee-Fromney syndrome or the Peutz-Jeghers syndrome, most commonly causing breast cancer in women. So these are a few of hereditary cancers that are commonly seen. And one good thing about hereditary cancers is that these can be detected, these can be identified in women or anybody in the family, and then it also can be prevented or managed. So basically a risk assessment can be done for a person. So if a person or an individual feels that they have a risk of breast cancers or hereditary cancers to be specific, they can consult a genetic counselor and a risk assessment can be done. If you have a wide family history of cancers, a strong family history of cancer, somebody affected at a very young age, somebody affected with multiple cancers. So these are some signs that could be a indication of hereditary cancer. Now, after the risk assessment is done, they can further go for the genetic testing, which is the testing or screening for hereditary cancers. And once that is done, once the hereditary cancer is identified, then you can see what you can do to prevent it or to manage your risk. So basically there are guidelines and management plans from NCCN or ASCO which can be followed to prevent or manage your risk of cancers in the future. So now there could be regular management plans or screening measures, or then there could be prophylactic or preventive surgeries that can be done like mastectomies or salpingophorectomies to prevent risks of cancers. Now, after this is done, further the family members can also get themselves tested to see who in the family can also have a risk of cancers next, and then their risk of cancers can be prevented too.
Thanks, Vaishnavi. Now, one of the most common questions, that is, how genetics can help in cancer treatment, and ultimately what is the role of genetic counselor in this cancer care?
Yeah, Aditi. So this is a most common question or a very common doubt people have, that why should I consult a genetic counselor if I have a cancer? So first of all, let's see how cancer and genetics can go hand in hand for the treatment. So let's see, if we have a cold, if we have a cough, what will be treated first? So we'll go directly to the root cause and that will be treated. If we have a viral syndrome, then we directly go to the virus and kill the virus. Similarly here, now that we know that cancer is something that is caused by a gene defect or a DNA defect, we will be directly targeting the DNA via targeted therapies. This is basically called precision oncology or precision medications. So this is done by the somatic testing. Now somatic testing or the tumor genomic profiling as we call it is basically screening the tumor DNA. So whatever is causing the tumor or whatever changes is there in the tumor DNA, that will be screened and then that will be directly targeted via medications. Or sometimes a lot of these biomarkers or a lot of alterations that are there inside the tumor DNA can also give the oncologist an idea about the prognosis, as in how good or how bad a patient can respond to treatment. That can also be known by doing the somatic testing. Furthermore, when we see about what a genetic counselor will do, so genetic counselor is basically acting like a bridge between genetics and cancers. So a lot of times, like I already told, people are not aware about the connection of genetics with cancers. Or cancers also a lot of times is a taboo topic and a lot of people don't discuss about it, and if there's a hereditary cancer, nobody really talks about it. So that is when a genetic counselor helps the patients to understand what is happening there, what is a cancer, how is genetics involved here, and how it is not a taboo to discuss about it. Genetic counselors help these patients to understand what the risk could be. The risk assessment is done by taking the family history, by looking at the cancer history of the patient as well. And then germline testing or even somatic testing, water testing is what will happen in the testing. All of that is explained to the patients. And if there is any hereditary cancer syndrome, the preventive measures, the management plans, and who are the family members who could be at a risk, all of that is explained to the family members. And similarly, when there is a somatic testing being done, the patients are explained about the outcomes as well, because a lot of times patients are being given treatments but they don't really know what the treatment is, why the treatment is being given, or what even that is called. So by letting the patient know about it, by giving them information about themselves, they can also have a better hope to fight cancer, because a lot of times when there's a cancer in a patient, they will lose hope that maybe there's no treatment, maybe I can't prevent this. So by giving them more hope and by bridging that gap between cancer and genetics, a genetic counselor helps the patient to have more hope and maybe help them get better.
Last but not the least, how can genetics empower women?
Yeah. So now talking about women empowerment in genetics, we first saw that there are a lot of cancers that are affecting women. So now this is a very interesting topic or a very interesting story that happened. So we know about Angelina Jolie, the Hollywood actor. So she identified that she could be at a risk of hereditary cancers because her mother was diagnosed with the cancer. Then she underwent the BRCA testing, was identified with the BRCA1 gene mutation, and she underwent the prophylactic mastectomy and took measures to prevent her risk of cancer. Now this could be something she did for herself, for her own health. But being at the position she is, being the celebrity she is, it created a wave through the masses, through the women worldwide or through the women in America. And the genetic testing rates went up, and all the women also underwent genetic testing influenced by her. So this is a classic example of women for women, how a decision one woman took helped so many women worldwide. They could recognize their risks of cancers and they could also prevent their risks of cancers. So this is how, by taking a small step, one woman can empower many women worldwide.
Thank you so much, Vaishnavi, for this amazing insight. Now, moving on to another crucial aspect of cancer care, that is the mental health. Jaitri, as an oncologist, you work closely with cancer patients to support them in their emotional and psychological challenges during their treatment. Now, cancer, especially in women, indeed challenging not only physically but also emotionally. So, do you feel that women and men are facing different kind of psychological and emotional challenges during their cancer treatment?
Yes, Aditi. So here let me tell everyone that during the cancer treatment, male and female both experience different emotional distress and psychological turmoils as well. So particularly for women, those who are undergoing treatment for breast cancer or ovarian cancer, and those who have already underwent surgery, for example breast removal, mastectomy or oophorectomy, also who have received chemotherapy and experiencing the side effects of chemotherapy. For example, hair loss, alopecia, discoloration of the nails, skin, and removal of the eyebrow hair as well. Those patients can experience severe body image issues. They can also start experiencing loss of femininity. Alongside, what we have seen that the younger patient, they always have the fear of being infertile after their cancer treatment. So now if I want to talk about the men who have been diagnosed with, for example, prostate cancer or testicular cancer, they are always distressed because they always start feeling that I am losing my masculinity, and probably it can also affect my sexual health as well, because we always know that after the treatment, as a treatment side effects, the men, they can start experiencing certain sexual functioning in their day-to-day lifestyle. Now, having said that, in a nutshell, we can say that yes, male and female, the cancer patients, they have their own psychological issues during the cancer treatment, but yes, the content can be a little different. Having said that, we always need to understand that there are multiple studies have published which always shows that the women, they always experience more psychological distress in comparison to men. So for example, let me give you a few points here. If a female, they are diagnosed with cancer, their major concerns will be probably I am not looking good, or as a mother probably I am not able to do justice with my children, or probably as a wife, as a daughter-in-law, probably I am not right enough. All these things can create severe distress within the female, but in the contrary, male cancer patients, they might feel that, no, I am the only single breadwinner of the family, and because of my treatment, probably my children, my family is spending a lot. So here, one interesting study recently published by National Cancer Institute, they showed clearly that where 15% to 30% women, they are experiencing severe psychological distress, depression and anxiety, where only 10 to 15% of the male cancer patients, they are experiencing anxiety, depression and psychological distress. So here, to a certain extent, we can always say, Aditi, that yes, male cancer patients and female cancer patients, they always experience psychological distress, but yes, the severity of psychological issues and psychological health concerns are seriously more for female cancer patients in comparison to the male cancer patients.
Thanks, Jaitri. I'm sure these informations will be immensely helpful for our patients as well as for a caregiver. Now, I would like to ask you that what are the signs that a caregiver, from which the caregiver can identify that the woman is in psychological distress?
It's a very good question, Aditi, because during the psychological counseling session, always we mention that first, all the psychological symptoms should be observed on a very mildly by the caregivers. Then only they will come to the psychologist, because caregivers are staying with the patient for 24/7. So here, let me discuss a few points through which the patient or the caregiver should understand that no, now probably my patient can go into depression, anxiety or simple psychological distress. So the first symptom should be consistent, persistent hopelessness and distress. For example, as a caregiver, if you start noticing that your female probably always very much negative, not at all positive about the treatment outcome, in persistent low mood or continuously crying, and even if the treatment is going on very good. So this is the sign that probably the patient is struggling with emotional distress. Second, uncontrollable panic or anxiety. For example, the day of receiving your chemotherapy or the day you are going to follow up to your oncologist, or probably one day before receiving your PET scan report, CT scan report or any report for sick, if the patient start experiencing severe anxiety, sudden breathlessness or even denies to go to doctor's cabin, then probably the patient is experiencing emotional distress. The another thing is that social withdrawal and social isolation. In our psychological counseling session, we have noticed many times that because of the cancer diagnosis and even the side effects experienced by the cancer patients, the females, they are not so much comfortable to step out, not too comfortable to mingle with their friends, family, relatives, and also with any activity that they used to like before. So here, we need to understand that if you notice that if there is any female cancer patients in your house and they are behaving in the same way, then probably they are experiencing severe emotional distress, and also that's the only reason that they are trying to isolate themselves from the world outside, right? So in this scenario, kindly connect with the psychologist who will help the patient to come out from the emotional distress slowly and gradually as well. The another point is that self-care. If you notice that no, the female patients, they are not at all taking their minimal self-care. For example, taking a regular bath or probably just washing a face. Even if the skin is very dry, they are probably not putting any moisturizer, not taking care of the kids at all, not even changing their bed sheet. Even if they have their enough physical strength, it means that they are even neglecting their minimal hygiene. It means the person is really going towards depression from distress. So that means now personalized psychological counseling session is very much needed. So these are a few signs and symptoms that caregivers always can notice within the patients. These are female cancer patients especially, and if you ever feel, then please don't hesitate to connect to a psychologist, and we are really going to help you from home-based care to come out from the emotional trauma or distress so that your quality of life can be very much better during the entire course of treatment.
Thanks, Jaitri. So in this context only, I want to ask you exactly what role a caregiver should play in this process?
Absolutely, Aditi, because as I said earlier, that caregivers are the one who is staying with the patient for 24/7. So the first and foremost step as a caregiver you can take, that is providing emotional support. And what do we mean by emotional support? Just listen to the patient. Just stay beside her. Just if the patient is crying, then please don't ask her to stop. Don't ask her that no, you need to be strong. Rather than allow her to express the emotions. If the patient wants to cry, allow her to cry. If the patient wants to share any negative thoughts that is bothering her inside, don't stop her anytime. That is the first important thing. That number two is that always try to encourage open communication. Open communication in the sense, for example, a few days ago I was having a conversation with one caregiver where the mother was 65 years old, receiving treatment for carcinoma ovary, and currently the patient is receiving chemotherapy. So here you will be surprised to know that the patient was not at all worried about, not at all aware about the hair loss, which is alopecia, a very common side effects of chemotherapy. So what happened here, the patient did not communicate with the oncologist, but the caregiver was the one who used to always interact with the oncologist, like when should be the follow-up, what drug my mom should take, and other things. So after second cycle of chemotherapy, when the patient started experiencing severe alopecia, she became completely depressed, and also she denied to go to oncologist from the third cycle onwards. So after that, during the counseling session, when we realized the concern, then we sat together, we spoke to the patient, we spoke to the caregivers as well, and we concluded that here sometimes we can also encourage the patient to ask questions directly to the oncologist if they have any doubt, for direct doubt clearance. And number three here, what also as a caregiver they can do, that helping the patient in daily practical activities. It means in our society we always know that women, they are always taking care of the household chores in majority of the families. So here any women, if they are not well and receiving treatment, then definitely they are probably weak, they are probably tired, and also because of the distress they are not feeling like working like before. As a result, the patient, the women might feel that probably I am not doing justice with my family or probably my kids, so they can feel guilty as well. So if as a spouse or probably as a mother, if you start helping your female cancer patients in the simple chores, for example, helping her to choose what clothes to wear, probably helping her to cook, reminding her to which medication to take, or probably what is the date of the doctor's appointment, when is the next date of doctor's follow-up. Even the small things can really help a patient to come out from distress a lot. Number four is helping the patient to take self-care. As we spoke in the last question, that if any woman is not doing the minimal self-care, for example, putting some simple moisturizer, or probably switching on the light, or probably not sleeping properly, not eating properly, just remind them to do this. Just remind them that probably now this is the right time. You need to go to washroom, just you need to wash your face, you need to put some moisturizer, or probably just you need to take a shower. Because you have the energy to do it, then why do you want to feel that no, I will not be able to do that and I always need someone else's support? I think as a caregiver, if you start implementing these small things, you can really understand the immense change into your female patient. So in a nutshell, what I want to conclude here, Aditi, that it's very important to frame personalized and gender-specific psychological interventions for the cancer patients, where not only the psychologist or probably the oncologist, but also caregivers, they can play an intense role always.
Thanks, Jaitri. Now, again, last but not the least, how can psychological counseling session empower women?
Amazing, Aditi. So before answering this question, let me give you a very small example. I assume last week I was taking a session with a patient who is currently receiving treatment again for breast cancer, mother of 2 kids, and experiencing severe body image issues because of the chemotherapy side effects. So now what is happening here, initially she was a very active woman, taking care of all the household chores, taking care of 2 kids, But because of the cancer diagnosis and the treatment side effects, because she told that no, now I'm not as pretty as before. And this small thing, because now this is the alopecia, she has completely stopped going outside. So the husband is taking care of the kids. The husband is taking the kids to school. So it's a mastectomy. As a result, the patient doesn't have any knowledge about what processes to use, exactly how she can take care of her body image as well. So here the point is there is no awareness that what precautions can be taken if I am experiencing body image issues and how should I come out of that. So after the psychological counseling session, here let me tell you that we focused on a few points. Number one, we allowed the patient to express her emotions because exactly what she was experiencing. Because as a woman, she was very hesitant, she was shy, and she thought that no, probably these things are very small, then probably I am not the right person, I cannot share all these things to my oncologist or probably to my mother-in-law, to my husband. So when she met with the psychologist, we probed them so that the person will be able to express her emotions so that we can understand exactly what are the level of distress and also what are the causes of distress as well. And number two, what we started that we provided the information about breast prosthesis and what are the type of breast prosthesis as well and what will be the benefits from using, how to use those, how to manage those, etc. Number three, we also taught that there are many things which is known as cognitive behavioral therapy. We explained that there are many things in our situations that we cannot control, but also there are many things as well that we can control. For example, what people will say, how people they're going to judge, we cannot take any action about those parts. But how I am going to react to that, about my social support, who can support me, who can love me, how I can do the physical exercise, how I can take care of myself, those are under my control. So, like this, we started challenging all the negative thoughts. We used their gradual exposure therapy, and after 2 sessions, now the patient has started stepping out slowly towards the doctor's chamber, probably towards the schools, towards her kids' tuition teachers' cabin as well. So it's always one step at a time. So Aditi, as you asked that what is the role of psycho-oncology for female who have been diagnosed with cancer? So first of all, this is a very open platform where the female can come, they can share their pain without any judgment. Because females, let me tell you, they are very scared. They always feel that, log kya kahenge, like what people they are going to talk about me, how they are going to judge me. So this is always an open platform. Number two, emotional catharsis. We are allowing the patient to express their emotions without any judgment, either it's good, bad, any sort of psychosexual issues, any sort of body image issues, or even the concerns about their kids as well. Number three, we are also discussing about multiple rehabilitation techniques, and also if possible, we are channeling them to the right person as well to a certain extent. And four is that it's about the properly managing the negative emotional thoughts, how the negative emotional thoughts the person herself can challenge, and all the negative emotional thoughts can be transformed into a positive thought pattern.
Thanks, Jaitri, for this insightful discussion. Now, moving on to another crucial pillar of cancer treatment, nutrition. Today, we have with us Ms. Sharmela Devi, an Onco Dietitian. Now, cancer, especially in women, brings unique nutritional challenge that impacts not only their physical health but also their overall well-being. Now, my question is for you, Sharmila, that the women who are suffering from hormone-related cancer, how important is diet in maintaining hormonal balance?
So patients who have undergone hormone-related cancers like breast cancer or ovarian cancer, estrogen plays a vital role in the reoccurrence of cancer and managing the treatments also. So we have to understand that there are certain food items which we have to avoid that will have a negative impact on the estrogen balance. And there are certain food items which we need to include in our diet on daily basis to maintain estrogen balance. So coming to the foods that needs to be avoided, number one is alcohol. Alcohol is actually termed as grade 1 carcinogen, and also even if it is taken in moderate amounts, it is going to affect the estrogen balance. It is going to raise the estrogen levels in the body, which will contribute to reoccurrence of cancer. And number 2 is red meats. Red meats are carcinogenic in nature. Means carcinogenic means food item that will contain cancer causing agents in them. So red meats are naturally carcinogenic in nature, so we have to avoid red meats. And number 3 is sugary foods. So what happens when we consume too much of sugary foods? It is going to affect the insulin resistance. On the other hand, again the hormonal balance is going to get affected. And finally, ultra processed foods. Even if it is soy products, ultra processed soy products must be avoided. So now coming to the foods to be included. Number 1 is cruciferous vegetables. Cruciferous vegetables like cabbage, cauliflower have some compounds with them which will help in metabolism of estrogen. And number 2, coming to the foods to be included, something very important is whole grains and fibers. Whole grains and fibers have enough fiber content with them, which is going to help in excreting the extra estrogen that is being produced and will help in improving the gut health. And coming to the very crucial aspect, being hydrated is also important, which is again going to help in removing the toxins from the body.
Thanks Sharmela for this useful tips. Now, what will be some key dietary tips for the women who wants to regain strength and wants to manage long-term side effect post-treatment? If you can kindly share with us.
Thank you, Aditi, for this question. Let us break this question into 2 parts. 1 in regaining strength, and number 2 is managing side effects. So coming to regaining strength, very crucial aspect, we have to concentrate on 3 different important nutrients. Number 1, carbohydrates. Number 2, proteins. Number 3, fats. So coming to carbohydrates, concentrating on complex carbohydrates is important instead of concentrating on simple carbohydrates. Okay, because simple carbohydrates is going to end up in insulin resistance only, whereas complex carbohydrates, as I already discussed, the fiber content is going to help us. Number 2, coming to the protein part, lean protein sources. So lean protein sources will include lentils, eggs and poultry and fishes. Okay, so protein, just because we need to meet the protein content, it doesn't mean that the patients can take up the red meat part. Red meat of course needs to be avoided. Our human body is proteinaceous in nature, so naturally we need to concentrate on protein. When it comes to cancer, and during treatment, post treatment, and to regain the strength, we need to concentrate on extra protein. The normal protein consumption is actually 1 gram per kg body weight, but coming to the extra requirement, it is in between 1.25 gram per kg body weight to 1.5 gram per kg body weight. If the patient is facing any kind of weight loss, then we can go up to 2 gram per kg body weight also, nothing wrong in it. In such scenarios, we will be depending on protein supplements. Now coming to the third part, fats. So we must depend on healthy fats like avocado and nuts and olive oil, and avoid the unhealthy fats like butter. That is important. Even dalda needs to be avoided. So coming to the side effect management. So whenever there is any kind of cancer treatment, side effects play a vital role in hindering the meeting the requirement of nutrients that is needed for the body. So what happens here? Let me list down few common side effects. Number 1, nausea. Number 2, bloating. Number 3, acidity. So this is something very common which is going to affect the nutritional intake. So whenever there is nausea, the patient is going to have the feel of vomiting sensation and not going to eat the food properly. And number 2, coming to bloating, they will consume the food, but post consumption there will be some discomfort which may make them feel like there is some kind of delayed digestion. Okay, and the acidity is caused because let us consider chemotherapy. So not only the cancer cells, all the cells are getting affected here. So our stomach lining is also going to be weak here. So that is one big reason why acidity occurs. So managing these side effects is something very important. There are certain foods which have anti-emetic properties which is going to help you in treating nausea. There are certain foods which is going to help you in preventing bloating and delayed digestion. So for example, I can tell ginger and mint will help in nausea, and ajwain and jeera will help in delayed digestion. Okay. And anemia is also one very important side effect that is common during cancer therapy. Both in targeted therapy, radiotherapy, let it be chemotherapy, whatever it is, anemia is something common. So what happens? As I told, all the cells are getting affected, the red blood cells are also getting affected here. So the red blood cells are going to go down. Hemoglobin value is getting affected, the patient is becoming anemic. So the key factor that we have to depend on here is iron rich food item. There are two types of iron rich food items. One is heme iron and non-heme iron. Means the vegetarian sources and the non-vegetarian sources. So when a patient is non-vegetarian, it is not going to be a greater challenge here, because non-vegetarian food sources, whatever iron those food items contain, it is going to get absorbed into our body as it is. But when it comes to vegetarian sources, the absorption is going to get hindered here. The absorption will be well good only if it is combined with vitamin C food items. So vegetarians can depend on palak or moringa leaf soups on a daily basis to improve the iron content, means to improve the hemoglobin values. And additionally, they can also depend on poha or ragi related food products and chickpea undals like that. When it comes to treating anemia, more than the foods that can be included, foods that needs to be avoided is important. So avoiding anything that contains caffeine is important. What happens when the caffeinated drinks are taken? It is going to hinder the process of iron absorption in the body. So once the patient is anemic, please stop the caffeine. Okay? So then we can concentrate on iron rich food items that will help in improving the hemoglobin. Hope now I am clear about how to manage the side effects and also how to regain strength.
Now, again, I want to highlight a very important domain of cancer treatment, that is the fear of recurrence. If you can kindly share some tips which can reduce the risk of recurrence.
Yes. So recurrence is again very crucial aspect. It creates fear among patients, those who have undergone, those who are diagnosed with breast cancers and ovarian cancers. So what we can do to prevent a reoccurrence is the whole lifestyle changes. So lifestyle changes include both diet and physical activity, which also have an impact on mental health. So when it comes to diet, depending on balanced meal is very important. Okay, 50 to 60% of carbohydrates, 25% of fat, and the remaining on protein, as I told, 1.25 to 1.5 gram of 1.5 gram per kg body weight of protein intake will help. And being hydrated is going to help in removing the toxins from the body, and that will help in regaining strength, preventing the fatigue part. Also, when it comes to recurrence, there are few food items we can again include here, as I mentioned previously, like cruciferous vegetables, flax seeds, chia seeds. Anti-inflammatory foods like turmeric, black pepper will help in being acting as an anti-cancer agents to the body. So by these ways we can prevent reoccurrence via diet. So coming to the physical activity, make sure that you are physically active. At least 30 minutes of brisk walk either in the morning or in the evening will help. Very simple. And weight management. Weight management plays a crucial role in reoccurrence. The reason is the fat deposition around the abdomen is related to estrogen balance. It may actually increase the estrogen any hormone related cancers. So weight management is important here. So it's not like only diet can help in preventing reoccurrence. A proper lifestyle management will actually help in preventing the reoccurrence part.
Now, is soya safe for the women who are at risk of breast cancer?
Of course, yes. Soya is proven to be safe for women at the risk of breast cancer, also those who are undergoing treatments. Only ultra-processed soy products must be avoided. Why I am telling soya is safe? Because there are studies which prove that soy products are safe for breast cancer patients.
And what is the role of dairy in cancer risk?
So this is actually a debated topic. So there are studies which tell dairy contributes to a negative impact of cancer, that is because of the growth hormones that is present in dairy products. Because those researchers tell that growth hormone can contribute to hormone related cancer. But again there are some stronger evidences which tell moderate amount of dairy is always safe. I can tell from my practice 250 ml to 300 ml of dairy products per day is actually a safer limit. Maybe if you are a patient who will be depending at least 500 ml to 700 ml of dairy products in the form of milk or paneer, then in such cases you can opt for almond milk or soy milk.
Thanks, Sharmela, for this useful tips.
Thank you, Aditi.
And thank you all the panelists for this enlightening discussion, Women versus Cancer, the power of genetics, nutrition and the mind in healing. Now, I would like to request our participants to type their queries in the chat box. Please feel free to type in any regional languages and our care companions will assist you with the translation. Now, I have already received one question. Is it true that turmeric tablets help cure cancer? I would like to Sharmela to help the caregiver.
So let me be clear here. As I already tell, just single food item alone cannot help in curing cancer. But turmeric, as it has curcumin in it, it actually has anti-cancer property. It plays a vital role. But curcumin tablets alone will not help in treating cancer.
Another question we have received for Jaitri. So, a patient has asked you any strategy to be active.
Okay. Here, let me tell you that first of all, we need to understand that what is the level of physical weakness, and number two, what is the diagnosis and what is the treatment details as well. So depending upon that only, we can give you, ma'am, one properly personalized intervention so that you can try to make yourself more physically active. So being physically active starts with simple walking for 30 minutes per day, probably 5 or 6 days in a week. Number two, you can also practice multiple stretching daily in the morning. So we have already created multiple contents regarding that, and I will request you to check Onco. So in Onco we have shared one simple video very recently where we have showed for the patients that what are the morning stretches that you can practice so that you can be physically very active and physically energetic the way you are starting a day altogether in a very fresh way. Number three is that there is mindfulness meditation that also we always suggest our patient to practice to be physically active. And what is most important thing here, so you all will be delighted to know that we have already started the yoga sessions and the wellness training programs for our patients as well, whoever is associated with 4-Base Care. So if you want to be a part of that yoga session and patient wellness program as well, so where we have a specialized person who will teach you very mild yoga daily in the morning or probably alternate days. So that is really going to be very much beneficial for you. So I will insist, I'm not sure whether this is the question from a patient or a caregiver. You please connect with us or your concerned care companion, so they will connect with me, ma'am or sir. So then we can have a good elaborate detailed session, and if you want to be a part of our wellness program as well, please, you are most welcome for that.
We have received another question again for Jaitri. Like you have spoke about breast prosthesis. Can you share the details here?
Surely, Aditi. So here, as I spoke earlier, that usually breast prosthesis should be used by the patients who have underwent mastectomy or modified radical mastectomy, which is basically removal of breast. Now, sir, what happens that usually after the surgery, usually the oncologist, they will always ask you, or probably the rehabilitation therapist or even the psycho-oncologist as well, we will suggest you to go ahead with the breast prosthesis. And now the breast prosthesis can be of multiple types. For example, it can be made of cotton, foam, or sometimes external silicone materials as well. So some items are heavy and some items are not. So here, if you want to know more about it, I will request you that after this discussion, kindly connect with your care companion, or also you can directly connect with us as well. So with our website, and so surely we can guide you on the same. But yes, uh, uh, it has multiple benefits definitely for the future. For example, it can help you to prevent your shoulder drop. It can help to manage a proper balance, proper posture for your future. So these things are very much needed.
Okay, next question we have received. What are the early warning signs of cancer that should not be ignored? Vaishnavi, if you can kindly help this patient.
Yeah. So a lot of times what we see is when there is a cancer, there will be very light symptoms. So a lot of times there won't be any symptoms as well. So in such cases, it is always important to, be careful about your health in general, like anything, just not cancer. You have to have regular health checkups, because we know that after a certain age, we are prone to certain illnesses. So maybe after the age of 35 or 40, having regular blood checkups done, having regular breast cancer screenings, ovarian cancer screenings, or prostate cancer screenings for men. And then certain symptoms like a prolonged fever, or maybe if you're feeling any lumps on your breast region, or near your neck, in your armpits, or if there is any blood in your urination, post-menopausal bleeding, after a woman reaches menopause, if there is again bleeding or spotting, maybe that could be a sign. And a lot of times if there's prolonged cough, prolonged anything that is unusual, any indigestion or constipation, that could mean that this could be a sign of some tumor or a small lump that has been developing inside, and that is something that should not be ignored.
Another question. Is the intake of alkaline water or alkaline solution safe during or after chemo? Sharmela?
Okay, so alkaline water therapy is actually a separate therapy like chemotherapy or radiotherapy. So it is we need not mix two or more therapies during any kind of treatment. That is not actually advisable. When coming to the alkaline part, I would like to be clear here. So we dietitians suggest you people to take more of vegetables and more of fruits. So whenever we are increasing the vegetable and fruit intake, automatically your food pattern becomes alkaline in nature. So coming to the alkaline water, or traditional mud pot water is alkaline in nature. So if you want to consume at a very much affordable cost, you can shift from plain water to clay pot water. That will be helpful. But please do not confuse in between the alkaline therapy and the other therapies. The therapy is completely different. There are people who have specialized in it, and the treatment is given separately for cancer patients.
Okay. The next question. What is the percentage of me getting cancer if one of my parents has cancer?
Yeah. Yeah, so let's just say that there is a cancer in any of your parents. First of all, if it is a hereditary cancer only, strictly, if it is a hereditary cancer, there is a 50% risk of the same alteration being passed on to you. So there is a 50% risk of having the same cancer causing gene that can be inherited from that parent. Again, if it is not a hereditary cancer, the risk of cancer being passed on is nil there. If it is not a hereditary cancer, it will not be inherited. Only if it is a hereditary cancer that a particular individual or a person has been diagnosed with, there is a 50% risk that all the first degree family relatives, as in the siblings, parents, children who are directly related to the individual or to the patient, can have a 50% risk of having the same gene that is there in the hereditary cancer patient as well.
Okay. Next question is also directed to Vaishnavi. Are all cancers genetic? How to identify if a future generation of a cancer patient can get cancer?
Yeah. So when you say genetic, the term is a little blurred here. So genetic basically means something that is there in the DNA. So as I told in the very beginning, every cancer is a genetic disorder. Every cancer is caused because of a genetic alteration or a change in the genetic material. So I assume by genetic you mean if every cancer is hereditary. No, every cancer is not hereditary. Only 5 to 10% of all the cancers are hereditary in nature. Most of the cancers, like if 5 to 10% are hereditary, 90 to 95% of the cancers are not hereditary. These will not be passed on in the generations coming forward. Now, how to identify a hereditary cancer? So the easiest way or the most foolproof way to identify a hereditary cancer is of course by doing the germline testing or the hereditary cancer screening, which is a genetic testing that will be done on the DNA to look for genes that could cause hereditary cancers. And how would you determine a hereditary cancer syndrome that could be there in the family? Again, as I said, if there are many individuals or many family members that are affected with cancers, or if somebody is affected with a cancer at a very young age. When I mean young age, it could be childhood cancers or certain cancers between the age of 18 to 35 or 40. Or if one person has been diagnosed with multiple cancers, let's say one person has both the breasts are affected with cancers, or one ovarian cancer, one breast cancer together has happened. Maybe that could be an indication of hereditary cancers, and that could be identified by the genetic testing itself.
Thanks, Vaishnavi. Now, next question is directed towards Jaitri. This question we have received from a caregiver actually. My aunt is worried about his daughter's future. Aunt is not well and the daughter is small. What tips would you like to share with this caregiver?
As we discussed during in the initial sections, Aditi, that is as a female cancer patients, majority of the women they start feeling that probably I'm a failure as a mother because I'm not able to do justice with my kids because I'm spending so much time for my treatment. So here we need to describe it in a very different way. So let's talk about the personality development theories, which is a core part of our development psychology. So ma'am, here I would like to say you that any children who has seen multiple adversities in their younger ages, surely what happens that when they grow older as an adolescent or probably young adult, their decision making capacity and their confidence level is gonna be far better than any other kids who has never experienced any adversities and nothing. So as a mother, we can completely understand her concerns. Having said that, this is one research findings or observation that I would like to share with you and your auntie is that please convey to her that as her children, which is a daughter, is always seeing the mother going to the hospital, experiencing all the side effects and struggling each and every day because she wants to feel better, she wants to come out from the cancer, then surely that struggle is going to impact the daughter very intensely. And as a result, whenever she will grow up, you need to believe that in comparison to any other classmates, the decision-making capacity or probably choosing the right career path in future, taking the right decision whenever she is going to be an adult is going to be far better than any other kids when they are going to be adult. So having said that, I would request you that kindly don't worry about your kids, rather than please be appreciated and grateful that no, you are really able to teach your kids some very great lessons that probably other kids they are not able to learn, because sometimes adversities also teaches us many important crucial aspects for our lives.
Thanks, Jaitri. Now, can any food changes our hormones?
Could you please repeat it?
Yes, sure. One patient or caregiver has shared this question with us. Can any food brings changes to our hormonal level?
Okay, so foods can bring changes to our hormonal levels. As I mentioned, cruciferous vegetables, they are going to help in metabolism of estrogens, and flax seeds and chia seeds are going to help in excretion of estrogens, and whole grains are going to help in balancing the hormones. So there are food items which is going to bring changes in the hormone levels. So for example, there is a technique called seed cycle, which is actually very much helpful in PCOS or PCOD. So what we do there, we suggest certain kind of food items during the follicular phase and during the other phases, which will help in balancing the hormones and treating the PCOS or PCOD issues. It is not only related to PCOS, also the other hormones like thyroid. There are food items which will help in balancing the hormones. So the thyroid values or the other hormonal value checkup is something very much necessary to get the consultation from the dietitian, and the dietitian can sure help in bringing changes to your diet pattern and balancing the hormones.
Thanks, Sharmela. Now, are there any cancer risk screening test? Is it safe to do? Vaishnavi?
Yeah. So when we say cancer risk screening test, I assume it is a cancer screening test. So yes, there are management plans and these are completely safe to do. These will be normal screening methods like how you go for probably an MRI or a blood test or a urine test. Just like that, this will be just screening, or sometimes endoscopies. It is just like that. These are completely safe to do. So I don't think there should be any problem in doing that. So just like how everybody goes for an annual blood sugar checkup or annual thyroid checkup, just like that you can do the blood test a lot of times. So the prostate cancer screening or the ovarian cancer screening, these are done via blood test itself. So it is completely safe and completely, good to do.
Thanks to all our panelists for clearing our participants' doubt. Now, we are almost at the end of today's event. I know there are lots and lots of questions were asked, but due to the restriction in time, we could not answer all the queries. But Ms. Vaishnavi, Sharmela and Jaitri are available in Onco to resolve your queries. Also, please feel free to share your feedback regarding our today's event, so that we can improve in future as well. It was great interacting with you all. Now for any queries or any further clarification or booking your counseling session, please feel free to reach out to us via Oncobody, or you can directly call us at our central number +63 66 84 3415, or you can mail us info@4wayscare.com for any further clarification. Now, I would like to express my sincere gratitude to all the panelists and the participants for being present at today's event. On behalf of 4Ways Care, we emphasize the importance of personalized care that will focus on every person's unique need and not just the illness. And at the end, I would like to apologize for the delay which has been caused due to the technical glitch. We will share this webinar link to all very soon. In conclusion, personalized care is the key in supporting patients and their families. So, let's continue to support each other and uplift, as women battling cancer deserves care, which is as unique and strong as they are. So, once again, thank you all who have made this event possible. So, let's support each other and stay empowered. Together, we beat cancer. Thank you all.